Today, we're talking about erythromycin ethylsuccinate suspension, Reconstituted. This medication is used to treat a wide variety of bacterial infections and may also be used to prevent certain bacterial infections. Erythromycin is known as a macrolide antibiotic, and it works by stopping the growth of bacteria. It's important to note that this antibiotic treats or prevents only bacterial infections and will not work for viral infections such as the common cold or flu. It's also crucial to use this medication only when it's needed, as using any antibiotic when it's not necessary can cause it to not work for future infections. When taking erythromycin ethylsuccinate suspension, Reconstituted, it's important to follow your doctor's instructions. You can take it with or without food, but if you experience nausea, taking it with food or milk may help reduce this side effect. Before taking the medication, make sure to shake the bottle well and use a special measuring device/spoon to carefully measure the dose. It's important not to use a household spoon as it may not provide the correct dose. The dosage and length of treatment will depend on your medical condition and how you respond to the treatment. For children, the dosage is also determined by their age and weight. To get the best results, take this antibiotic at evenly spaced times. You should take it at the same time every day to help you remember. If you're using this medication to treat an infection, it's important to continue taking it until the full prescribed amount is finished, even if your symptoms improve. Stopping the medication too early may cause the infection to return. If your condition doesn't improve or gets worse, be sure to contact your doctor. If you're taking this medication to prevent certain bacterial infections, make sure to take it exactly as directed by your doctor and do not stop taking it without their approval. Some common side effects of erythromycin ethylsuccinate suspension, Reconstituted include nausea, vomiting, diarrhea, stomach pain/cramping, and loss of appetite. Taking this medication with food may help reduce these symptoms. It's important to remember that your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. However, if you experience signs of liver disease, unusual tiredness, muscle weakness, trouble speaking, blurred vision, drooping eyelids, hearing loss, severe dizziness, fainting, fast/irregular heartbeat, or symptoms of a severe intestinal condition such as persistent diarrhea or abdominal pain, it's important to seek medical help right away. Prolonged or repeated use of this medication may result in oral thrush or a new yeast infection. If you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms, contact your doctor. While very serious allergic reactions to this drug are rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before taking erythromycin ethylsuccinate suspension, Reconstituted, it's important to let your doctor know if you have any allergies to erythromycin or other macrolide antibiotics. Also, discuss your medical history, especially if you have kidney disease, liver disease, or myasthenia gravis. Erythromycin may affect your heart rhythm, so be sure to inform your doctor if you have any heart problems or a family history of heart issues. It's also important to mention if you have low levels of potassium or magnesium in your blood, as this may increase the risk of heart rhythm problems. If you are on a salt-restricted diet or have a condition that could be worsened by increased salt intake, talk to your doctor before using erythromycin products that contain sodium. Older adults and babies may be more sensitive to the side effects of this drug, so be aware of any hearing loss in older adults and watch for signs of serious stomach problems in babies. If you are pregnant or breastfeeding, consult your doctor before using this medication. When taking erythromycin ethylsuccinate suspension, Reconstituted, it's important to be aware of potential drug interactions. This medication may interact with other drugs such as digoxin and affect the heart rhythm, including drugs like amiodarone, dofetilide, pimozide, and others. Additionally, other medications can affect the removal of erythromycin from your body, which may affect how it works. It's important to inform your doctor of all the products you use, including prescription/non-prescription drugs and herbal products, to ensure safe usage of erythromycin ethylsuccinate suspension, reconstituted. Additionally, this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this medication. If someone has taken too much erythromycin ethylsuccinate suspension, reconstituted, and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek emergency medical help by calling 911. In less severe cases, contacting a poison control center is recommended. U.S. residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Remember, it's important not to share this medication with others. Your doctor has prescribed this medication specifically for your current condition, so it's important not to save it for another time or use it for a different infection unless your doctor advises you to do so. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. It's important to store your erythromycin ethylsuccinate suspension, reconstituted according to the instructions on the product package or from your pharmacist. Make sure not to freeze it or store it in the bathroom. Keep all medications out of reach of children and pets. When you no longer need the medication or it has expired, consult your pharmacist or local waste disposal company on how to properly dispose of it. It's important not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.